Republicans in the Senate are just hours away from the big reveal for Obamacare repeal and replace, a bill they've been working on. Plus, there's a to-do list, including tax reform, the budget, raising the debt ceiling, and tackling infrastructure. A long list without much time left before summer break. But will there even be a summer break? Chief Congressional Correspondent Mike Emanuel tonight with a look at where lawmakers are now and what to expect in the morning.
Senate Republicans will review a discussion draft of health care reform first thing in the morning. It's expected to be more moderate than the House bill, cutting off the Medicaid expansion slower and by providing more generous subsidies for low-income people. But sources familiar suggest it would be tougher than the House in slowing the growth of Medicaid spending.
For the past 7 years, Obamacare has continued to hurt the people we represent. For the past 7 years, Republicans have offered ideas for a better way forward, and soon we will finally have the chance to turn the page on this failing law.
McConnell's in a tight spot, only able to lose 2 of his Senate Republicans in order to pass the bill with Vice President Pence serving as the tiebreaker. Republicans from states where their constituents are losing insurance options under Obamacare say the status quo is not sustainable.
Far too often, I hear that high monthly premiums are squeezing pocketbooks, and that soaring out-of-pocket costs like deductibles and co-pays make coverage unaffordable.
Democrats have attacked the GOP for a lack of transparency, and Senate Democratic leader Chuck Schumer has suggested if the Senate GOP plan were any good, Republicans would be bragging about it.
They'd be preaching it from the mountaintops. There'd be a brass band down every main street in America announcing this new legislation. But no, they're afraid to even whisper about their bill. They want it out in the open for as little time as possible.
Others accuse the GOP of rushing it.
10 days, start to finish, to rewrite the health care system of America. 10 days on a measure that has not been disclosed to the Republican senators, not all of them, let alone the Democratic senators, let alone the American people.
Even some veteran Republicans are expressing concern about how this health care reform has been crafted.
Well, I'd like to see vigorous debate and amendments on the floor of the Senate. I would have liked to have been more involved in, frankly, what almost none of us have been involved in, that's shaping it.
But the calendar is becoming an issue. After the 4th of July holiday, lawmakers are expected to work on a fiscal year 2018 budget. That budget will be critical if leaders intend to keep their pledge to do tax reform later this fall, passing it with 51 votes in the Senate instead of 60 votes using budget reconciliation. They'll also have to address the debt ceiling in either July or maybe September. There's also FAA reauthorization due September 30th, along with funding the government.
There's also the pledge to do infrastructure, something that was big during the campaign, but sources say has not gotten much attention in recent weeks. When you consider an August recess, if Democrats continue stall tactics, time becomes a factor. Brett?
Mike, on the health care bill, what about defunding Planned Parenthood? Is that in the Senate bill?
Brett, we've been getting mixed signals, some saying it's in, some saying it's out. If you defund Planned Parenthood, obviously you win some of the conservatives in the Senate who are looking for a win. You risk alienating some of the moderates like Lisa Murkowski of Alaska and Susan Collins of Maine. It shows you the tightrope that Senate Majority Leader Mitch McConnell is walking. We will see in the morning, and then we will expect to get a Congressional Budget Office assessment by Monday, Brett.
Tiptoeing through the Republican caucus there. Mike Emanuel live on the Hill. Mike,